Hello everyone, this is Ashraf Hassanpour from Shiraz University of Medical Sciences, Anatomical Department. Welcome to another human neck anatomy lecture. As we saw in the previous lecture, despite being a relatively small region, neck contains a range of important anatomical features. But is there a way to organize and remember all these structures? Well, fortunately there is. And now we are going to be exploring just that as we learn about the triangles of the neck. The triangles of the neck are simply an organization method that parses or compartmentalizes the vast amount of the anatomical detail that is found in the anterior and lateral aspect of the neck into manageable and easy to remember study unit. So in this lecture, we are going to be examining each of the triangles of the neck, and we are going to learn about the anatomical landmarks and structures that we can see in and around these triangles. The triangles of the neck can be divided into two main groups, the anterior triangle and the posterior triangle, where the point of division is at the sternocleidomastoid muscle, which is the big muscle that bulges out when you turn your head from side to side. We'll first discuss the anterior triangle of the neck. The anterior triangle is bordered laterally by the anterior border of the sternocleidomastoid muscle, and it is bordered medially by the median line of the neck, and superiorly by the inferior border of the mandible. And you can imagine that the apex of the anterior triangle is pointing towards the manubrium of the sternum. The anterior triangle of the neck is further divided into smaller triangles: the submandibular triangle, the submental triangle, the carotid triangle, and the vascular triangle, which will be discussed shortly. Let's now have a look at the submandibular triangle, which is situated inferior to the mandible, where the submandibular glands are located just as the name suggests. The triangle is bordered superiorly by the mandible and the anterior and posterior bellies of the digastric muscle. The floor of the submandibular triangle is made by the mylohyoid muscle as well as the hyoglossus muscle, which also forms the floor of the oral cavity. The triangle is also covered by the skin, fascia, and the platysma. Well, as you see, the covering or the roof of all triangles will be the same. The submandibular triangle contains many structures, therefore making it an important anatomical location. The mylohyoid muscle divides the submandibular triangle into a superficial and deep compartment, and in the superficial layer of the triangle you'll find the submandibular gland and its lymph nodes. The facial artery with its corresponding vein runs through the gland and gives off a branch called the submental artery, which will supply the chin area. The mylohyoid nerve, which arises from the mandibular branch of the trigeminal nerve, innervates the mylohyoid muscle, and the anterior belly of the digastric muscle can also be found in the submandibular triangle. In the deep layer of the submandibular triangle, the genohyoid muscle that is seen in the midline of the floor of the oral cavity, and the hyoglossus muscle, which is one of the tongue muscles, are seen. And lingual artery and vein can also be found in the deep layer of the submandibular triangle. In this view, the second anterior triangle, which is the submental triangle, seen here medial to the submandibular triangles. And this triangle is a median triangle, meaning that it is located on the midline of the neck and occupies both the superior portions of the right and left anterior triangles. and this submental triangle is bordered laterally by the two anterior bellies of the digastric muscles and inferiorly by the hyoid bone. And the body of the hyoid bone forms the triangle's base, and the apex of the triangle points toward the mandibular symphysis, and the floor is formed by the mylohyoid muscle. The submental triangle is very small and contains small veins such as the submental veins that drain to the anterior jugular vein, and these structures that are found in the triangle include the submental lymph nodes. The next triangle is muscular triangle, and as you can see, the two muscular triangles share a border at the median line of the neck. The muscular triangle, which is also known as the omotracheal triangle, is bordered superiorly by the hyoid bone, supralaterally by the superior belly of the omohyoid muscle, and inferolaterally by the sternocleidomastoid muscle. And the base of the triangle will be the shared median line of the neck, as we have discussed earlier. The apex of the triangle will be at the point where the sternocleidomastoid and the superior belly of the omohyoid muscles intersect. In this triangle, we'll find a number of structures including the infrahyoid muscles, and these include the thyrohyoid, the sternothyroid, and the sternohyoid muscles. And also in this area, you'll be able to find some important organs, and these include the thyroid gland and the parathyroid gland, which makes important hormones for the proper functioning of the body. The vessels supplying the organs will also be found in this area, such as the superior thyroid artery and vein, the inferior thyroid artery and vein, and the anterior jugular vein. These glands will be discussed in the next part of the lecture. The last triangle of the subdivisions of the anterior triangle is the carotid triangle, which is an important anatomical landmark as it contains some important vessels and nerves. It is bordered anteriorly by the superior belly of the omohyoid muscle, superiorly by the posterior belly of the digastric muscle, and posteriorly by the anterior border of the sternocleidomastoid muscle. The floor is made by part of the thyrohyoid muscle, which is this short muscle below the hyoid bone, the hyoglossus muscle, which is the muscle above the hyoid bone, and by the middle and inferior constrictors of the pharynx. The carotid triangle is also covered by the deep and superficial fascia, platysma, and the skin, as with all other triangles. So, in the carotid triangle, there is an important structure called the carotid sheath, which is a fibrous connective tissue sheath that is part of the deep cervical fascia of the neck surrounding the vessels and the nerves that we are now going to discuss. This sheath contains the common carotid artery, which is located laterally in the sheath, the internal jugular vein, which is located medially, and the vagus nerve, which is found posteriorly between the vessels. The carotid sheath may also contain deep cervical lymph nodes, and this is also an important place to note, as it's the place where the common carotid artery bifurcates into the external and the internal carotid arteries. So there is a few other structures that are found in the carotid triangle. So several branches of the external carotid artery are found within this triangle, such as the superior thyroid artery, the lingual artery, the facial artery, the ascending pharyngeal artery, and the occipital artery. The veins that drain into the internal jugular veins are also found in the carotid triangle, and they mostly correspond to the arteries that we mentioned previously. The nerves found in this triangle are the hypoglossal nerve, which is located superficial to the carotid sheath, a small portion of the accessory nerve, and the ansa cervicalis, which is a looped nerve superficial to the internal jugular vein and the common carotid artery. Knowledge of triangles of the neck is of great importance for the evaluation of the pulses in the cardiovascular examination. Within the carotid triangle, the carotid artery pulse can be measured to determine the central pulse, which can also be compared to the radial artery pulsation measuring the peripheral pulse. We'll now have a look at the posterior triangle, and it is located in the lateral part of the neck, as you can see in this picture. The posterior triangle is bordered anteriorly by the posterior border of the sternocleidomastoid muscle, posteriorly by the anterior border of the trapezius muscle, which is part of the back muscles, and inferiorly by the clavicle. The triangle is covered by the investing layer of the deep cervical fascia, and the inferior belly of the omohyoid crosses the posterior triangle, dividing it into a small supraclavicular triangle and a large occipital triangle. The filler of triangle is formed by the prevertebral fascia, which covers some muscles that also make the fillers of the posterior triangle, such as the splenius capitis, the levator scapulae, and the anterior, middle, and posterior scalene muscles. Let's talk now about the supraclavicular triangle, which is also known as the omoclavicular triangle or the subclavian triangle. And this triangle is bordered superiorly by the inferior belly of omohyoid muscle, anteriorly by the sternocleidomastoid muscle, and inferiorly by the clavicle. And the filler of this triangle is largely formed by the anterior and middle scalene muscles, while it's covered the same as all the other triangles as we have discussed earlier in the lecture. In this space, you can find the distal part of the subclavian artery located between the anterior and the middle scalene muscles, which is this long muscle that you can see on the lateral side of the neck. And if you can, think of the scalene muscles looking like a tent over the artery. The transverse cervical artery running superficially along the two scalene muscles, and the dorsal scapular artery with their veins can also be found in this suprascapular triangle. The external jugular vein, into which the retromandibular and posterior auricular veins drain, is located superficially behind the sternocleidomastoid muscle, and finally drains into the subclavian vein. This triangle also contains a portion of the brachial plexus and its branches, and the cervical plexus and its branches, such as the pharynx nerve, which innervates the diaphragm. Above the supraclavicular triangle is the large occipital triangle, also known as the omotrapezius triangle, and this is the second part of the posterior triangle of the neck. It's bordered anteriorly by the posterior border of the sternocleidomastoid muscle, posteriorly by the trapezius muscle, and inferiorly by the inferior belly of the omohyoid muscle. And the filler is made by the splenius capitis, the levator scapulae, and the middle scalene muscle. In this triangle, vessels such as the occipital artery and transverse cervical artery with its veins can be seen. And there are many nerves that can be found in the occipital triangle, like the accessory nerve, which runs in front of the sternocleidomastoid muscle and pierces it, and the upper part of the brachial plexus, and the cutaneous branches of the cervical plexus, and the pharynx nerve running down the anterior scalene muscle are also found in this space. So we've gone through the most important triangles of the neck. Now we are going to look at the thyroid gland. Are you ready? Let's get to it. This is the thyroid gland. Yes, that well-known butterfly-shaped gland found in the neck region. Although comparatively tiny, it controls many vital processes in our body, like metabolisms, cardiovascular function, and even growth and development. The thyroid gland is located in the base of the neck, just anterior and lateral to the trachea and inferior portion of the larynx. It spans from approximately the level of the C5 to T1. The thyroid gland is generally butterfly or H-shaped in appearance and is composed of two primary lobes, each with a defined superior and inferior pole. These two main lobes are simply known as the right lobe and the left lobe of the thyroid gland, and roughly similar in size and shape. Connecting the two lobes is a region of the thyroid gland called the isthmus. In many people, there can be a smaller third lobe which is only present in about 40% of the population. This is the pyramidal lobe of the thyroid gland and can vary in size and appearance. It is thought to be a remnant of the thyroglossal duct which is present during development. Functionally, however, it is the same as the other lobes of the thyroid gland. The other glands that feature in this lecture are the parathyroid glands. In this image, we are looking at the thyroid gland from a posterior view. Usually, there are 4 parathyroid glands in total, 2 on the posterior aspect of each lobe of the thyroid gland. Each parathyroid gland is about the size and shape of a pea, at roughly 6 mm long, 3 to 4 mm wide, 1 to 2 mm deep, and weighing on average 50 to 60 milligrams. The number, location, and size of parathyroid glands can vary, which is important to keep in mind for events such as surgery or cancer metastasis. The parathyroid glands are also endocrine glands, producing hormones that play an essential role in the regulation of the calcium levels. The hormone they produce is called parathyroid hormone, which raises calcium levels in the blood. The thyroid gland is an especially well-vascularized structure. So let's take a look at how the body supplies both the thyroid and parathyroid glands. The thyroid gland receives blood from 2 pairs of arteries, the superior thyroid arteries and the inferior thyroid arteries. The superior thyroid artery arises from the external carotid artery. It splits into an anterior branch and a posterior branch. The anterior branch supplies the anterior portion of the gland and travels toward the isthmus. The posterior branch supplies the lateral and medial surfaces of each lobe. Moving down to the inferior thyroid artery, it often arises from the thyrocervical trunk, which comes off the subclavian artery. The inferior thyroid artery also has 2 branches, this time into an ascending or superior branch and an inferior branch, which supply the inferior and posterior aspects of the thyroid gland. It is important to note that the superior and inferior thyroid arteries anastomose with each other both from the same and the opposite side. About 10% of the population have an additional non-paired artery that supplies the thyroid gland called the thyroid ima artery. If present, this artery most often arises directly from the brachiocephalic trunk, but can occasionally come directly from the arch of the aorta or the right common carotid artery. Draining the thyroid gland, we have 3 pairs of veins: the superior, the middle, and inferior thyroid veins. All these veins emerge from a thyroid venous plexus within the gland. The superior thyroid veins drain the superior aspect of the thyroid gland, and they travel very near to superior thyroid arteries. These veins travel toward the carotid sheath and drain into the internal jugular vein. The middle thyroid vein exits the lateral side of the thyroid gland and also drain into the internal jugular vein. The inferior thyroid veins are formed from the preatrial plexus. The plexus draining into one common inferior thyroid vein, which can sometimes happen. This single inferior thyroid vein will either drain into the left or right brachiocephalic vein, or occasionally directly into the superior vena cava. When the inferior thyroid veins do not form a single trunk, the left drains into the left brachiocephalic vein, and the right usually drains into the right brachiocephalic vein, or sometimes into the superior vena cava. We'll now explore the vascular supply to the parathyroid glands, starting with the arteries. Luckily, a lot of it is quite similar to thyroid gland. The arteries are the inferior thyroid arteries arising from the thyrocervical trunk. This artery supplies the posterior aspect of the thyroid gland, and since the parathyroid glands are located on the posterior aspect, it makes sense that they get their blood supply from the inferior thyroid artery too. The venous drainage of the parathyroid glands is also shared with the thyroid gland. Blood from the parathyroid glands drains into the thyroid venous plexus and then follows the paths of the thyroid veins. The last topic we'll tackle with these glands is their innervation. The thyroid gland is innervated by both the sympathetic and parasympathetic nervous systems. The nerves from these systems act on the blood vessels within the gland to constrict or dilate them as needed. Nerves from all three cervical sympathetic ganglia innervate the thyroid gland. Here we can see the superior, middle, and inferior cervical ganglia in the neck. The parasympathetic nervous system gets to the thyroid gland in two ways. Both these nerves, however, arise from the vagus nerve. The first is the external branch of the superior laryngeal nerve, which we can see approaching the area of the thyroid gland from the superior aspect. The second is the recurrent laryngeal nerve, which comes towards the thyroid gland from an inferior angle. Remember, both are branches of the vagus nerve, cranial nerve 10. Innervation to the parathyroid glands is nice and straightforward. It only receives sympathetic innervation, which comes from the superior and middle cervical ganglia. Alright, that's the anatomy part of the lecture finished. But let's take a look at the significance of the thyroid gland in a clinical setting. Normally, our thyroid gland is a small and not very noticeable structure in our neck. But just like any organ, things can go wrong, like this. Can you guess what's going on here? This is a picture of goiter. A goiter is an abnormal enlargement of the thyroid gland, most commonly caused by a lack of iodine in the diet. Other causes can include autoimmune disease such as Graves' disease or Hashimoto's disease. Symptoms include swelling in the base of the neck. It's usually painless, but it can cause coughing, difficulty swallowing and breathing, hoarseness, and a tight feeling in your throat. Treatment depends on the size, symptoms, and underlying cause of the goiter, and can include medications, particularly if thyroid hormones need to be replaced, or surgery. Okay, now that brings us to the end of our lecture. Thanks for sticking with me, and happy studying!